Hello everyone, my name is Ruth Hogg and I'm the Professor of Ophthalmic Epidemiology and Public Health at Queen's University in Belfast. So that means I'm very interested in the number of people who have specific eye diseases in the population. I then try to understand the risk factors and why some people develop eye diseases as they get older and why others don't. I'm particularly interested in the factors that can be modified and thinking about how we can help people to modify their behaviour to prevent or to delay the onset of diseases such as age-related macular degeneration. So I spoke on a similar topic last year at the conference, and I believe the talk is still available to view on YouTube. So during that talk, I covered the basis of why we believe nutrition is important to eye health, and also some of the main studies that have contributed evidence to our current understanding. So I don't want to cover the exact same ground this year. So if this is the first time that you've explored this topic, I'd encourage you to listen also to that first talk. But this year, I want to concentrate more on some of the common questions that we received both after the talk last year and also that are sent through to the Macular Society about diet and nutrition throughout the year. And I also want to share some of the most recent data that has emerged since last year on this topic. So as with last year, I've prepared slides for this presentation, but they just contain photographs of whatever I'm talking about, such as maybe different types of foods or the logos of the studies that I'm discussing. So you can be assured that there is no additional information in the slides, and therefore those of you with a severe sight impairment will not be at any disadvantage with respect to the slides that I'm presenting. So the first new piece of evidence that I'd like to share with you this year is the update that has been made to the Cochrane systematic review that assesses the evidence for antioxidant and vitamin and mineral supplements for slowing the progression of age-related macular degeneration. So a Cochrane systematic review is a very detailed summary of the research studies on a specific health topic. So it carefully combines and analyzes the results from different studies to provide a clear, reliable answer to a specific healthcare question, such as whether a treatment works or how effective it is. And obviously in our context, this is about how effective supplements are for slowing the progression of AMD. So a Cochrane review helps both patients and healthcare providers make better decisions based on the very best available evidence. So within the scientific and clinical community, the Cochrane Library is very highly regarded by experts because it seeks to provide reliable, unbiased, and rigorously reviewed evidence. So each systematic review is conducted by teams of independent expert researchers who follow strict guidelines to ensure that the findings are both accurate and comprehensive. So the reviews are regularly updated to reflect the latest research, so making them a trusted source for up-to-date information. So this review was undertaken by Professor John Lawrenson from the City University in London and by Dr. Jennifer Evans from the London School of Hygiene and Tropical Medicine. So they've done this a number of times, and this is the most recent update of the evidence. So they searched for all the studies relevant to the topic, and they eventually included just 26 studies that met the strict quality and inclusion criteria, and that incorporated approximately 12,000 research participants. So when they looked specifically at the studies that compared people taking supplements with those that didn't, with early and intermediate stage of AMD, they found that those that were taking the supplements were less likely to progress to late AMD than those that didn't. So this is obviously in keeping with obviously the research that has gone before, but how much and how big was the effect? So they've helpfully tried to help us understand the size of the effect in this way. So how they've described it is that if you can imagine that we have 1,000 patients with the very earliest stages of AMD, and if those 1,000 patients took the supplements, then approximately 4 fewer patients would progress to late AMD than if they didn't take the supplements. If we look at the intermediate stages of AMD, so those are patients with larger drusen and possibly some pigmentary changes. So if we could imagine 1,000 of those patients with then there would be approximately 78 fewer cases of progression to late AMD than if they hadn't took the supplements. So you can see that while the effects are significant, they are still moderate in their size, particularly with those with the very, very earliest stages. So the second piece of new evidence that I want to share with you is an update to some of the evidence that has come from the age-related eye disease study, or the AREDS study. So as many of you are probably aware, that the AREDS study was initiated back in the 1990s, and AREDS 1 reported in 2001, and then AREDS 2 in 2013. And both of these studies together have played a very significant role in shaping our understanding of both diet's impact on AMD and also the role of supplements. So it investigated the effects of high-dose antioxidants and zinc supplementation on AMD progression, and they recruited patients with a medium or large drusen in both eyes, and also some patients with wet AMD in one eye and drusen in the other. And both of these studies found that the combination of vitamin C and E, beta-carotene, zinc, and copper reduced the risk of advanced AMD. So in AREDS 1, a beta-carotene was used, but then due to concerns of risk of lung cancer in those that smoked, in AREDS 2, this was replaced by lutein and zeaxanthin, and the same type of effect was seen with AREDS 2, and therefore, because of the better safety profile, it is the AREDS 2 formulation that we tend to recommend for reducing that risk of progression to advanced AMD. So we're now nearly 10 years on from the AREDS 2 results, and the study investigators have continued to follow participants and continue to analyze the data. And it's some of these long-term results that they have reported this year. So as you know, there's been some treatments approved in the US for geographic atrophy, but like those that are currently in use worldwide for wet AMD, they are going to require frequent eye injections, which we know are expensive, carry risks, and offer only modest benefits. So the AREDS study investigators recently published a study that looked at the long-term effects of supplements on how fast geographic atrophy progressed. So before this, the AREDS was always just looking at that progression to late AMD, but this is actually looking now at how the geographic atrophy progresses in those that continue to take the supplements. So it re-examined data from both AREDS 1 and AREDS 2 to determine if taking the supplements could slow geographic atrophy. And the researchers measured specifically how quickly the geographic atrophy progressed towards that central part of our retina, the macula, which we know is really crucial for sharp vision and reading. So the results showed that in patients with GA that had not reached that central macula, that those taking the antioxidant supplements experienced slower progression of the disease compared to those that did not take the supplements. However, the supplements did not significantly slow the overall growth of GA in terms of area. So for patients, this study suggests that taking the AREDS 2-like supplements could potentially delay worsening of vision and geographic atrophy by slowing the damage to that central important part of the eye and offering a more accessible and less invasive treatment option for geographic atrophy. So I'm also often asked about if it's worth taking supplements for wet AMD, and unfortunately we don't have the evidence to know the impact of that as yet. So another frequent question, particularly in the UK, is around the specific content of the supplements, particularly if they don't conform strictly to the AREDS 2 formulation. And this is a difficult question to answer, as there are lots of additional ingredients that there may be a good scientific rationale for why they may be helpful in AMD, but getting sufficient evidence that would satisfy a clinician to recommend them or the NHS to prescribe them is a very costly exercise. So the AREDS study, it was 2,000 to 3,000 participants. You need really long-term follow-up, and therefore that's why we always keep coming back to these AREDS formulations, because those are the supplements that have the very high quality evidence available. So just a reminder, if you are considering taking a supplement, that the Macular Society have some excellent information available on their website for you to consider when you're making that decision, and also that it's a good idea to discuss it with your GP, because we know that some of the vitamins can interfere with other medications that you may be on, and also it's important to purchase them from a reputable company, as the quality and therefore the content of the supplements can vary quite widely. So another question from last year was around the evidence linking AMD to ultra-processed foods. So the issue about ultra-processed foods and health has been quite a lot in the news and the media, and it's kind of a new type of way of dividing foods into groups. So ultra-processed foods usually contain it's usually things like sugary snacks, highly processed meats, prepackaged meals, and they do typically tend to be high in unhealthy fats, sugars, and additives, and low in essential nutrients. So while as yet there's no real robust studies that have directly looked at ultra-processed foods in the kind of strict category that they're now understood, if we think of the research that is available on AMD and diet, we know that foods high in unhealthy fats, sugars, and additives can contribute to inflammation and oxidative stress, which are both known to impact the development of progression of AMD. So although I can't provide definitive evidence. I would suspect that if somebody does work out a way how to extract data on ultra-processed foods from our commonly used food frequency questionnaires, I would expect that there may well be a relationship based on what we know currently about diet and AMD. So I think this then brings us back to some of the material I shared last year about the benefits of adopting a Mediterranean style diet. So rather than the kind of highly processed foods, we should always be thinking in terms of a diet high in vegetables, fruits, fiber, olive oil, pulses, and lean proteins such as fish and chicken. And while that may not describe the kind of standard UK type diet, making small changes to the foods that you choose and cook until they become a habit in your lifestyle can be a good way of kind of gradually adopting this more sort of Mediterranean style of eating. So I think the key thing is not to get too fixated on specific foods, but to try and enjoy a colourful variety that will hopefully provide the interest and a satisfaction that will make giving up some of those more sort of high fat sugar treats and snacks not such a challenge. So just remembering the concept of eating a rainbow, eating a variety of healthy foods as different colours contain different beneficial nutrients in quantities that are best used for absorbing in our body. So by eating a rainbow, it ensures that we eat a range of important antioxidants and nutrients into our body. We also received a question about alcohol last year, and while the relationship between alcohol and AMD has yielded mixed results, with some studies indicating risks and others showing no impact, a recent systematic review and meta-analysis suggests an increased risk for early AMD with both moderate and heavy drinking compared to non-drinkers or occasional drinkers. So this research is probably more in line with the relationship between alcohol and some other diseases such as cancer, and in that you can't really justify alcohol consumption in terms of gaining a health benefit. So this leads me to the last point that I want to make. We tend to always describe AMD as a multifactorial disease. While we understand there is a substantial genetic component, hence the need to discuss this type of material with family members who may also be at increased risk, we also understand that there's a whole range of factors that work together to determine whether somebody develops AMD and also the rate at which they progress and possibly even the type of disease that they develop. This can sometimes make it confusing for patients and their families to know what to do. However, many of the dietary and lifestyle changes that we understand now can result in healthier eyes, will also result in healthy hearts, healthy brains, and an overall healthy body. As you can probably see, a lot of the dietary advice that I've referred to is similar to that for reducing cancer risk, diabetes, and heart disease. So other things like adding exercise and physical activity to your daily routine, avoiding smoking, maintaining good sugar levels, and careful management of chronic conditions such as high blood pressure and high cholesterol can improve your eye health and reduce risk of AMD. So hopefully this information provides a more holistic idea in terms of overall body health that will make making the beneficial choices easier and possibly less confusing. So just in conclusion, there is strong evidence to support the preventative impact of a healthy diet and a lifestyle on the development and progression of advanced AMD. So if you are considering supplements, remember to talk to your ophthalmologist or GP to decide which are the right choice for you. I'd also encourage you to make stepwise small changes in your diet and lifestyle to adopt more practices suggested, and that this will not just benefit your eyes, but benefit your whole body. And finally, to discuss the increased risk of AMD with your family members and to encourage them to adopt a healthy diet and lifestyle and regularly get their eyes checked by their local optometrist. Thank you.